Today we will be talking to Verity Paz, who is one of the clinic directors at the Natural Fertility Clinic, and we'll be talking about polycystic ovary syndrome. What is polycystic ovary syndrome?
Polycystic ovary syndrome is one of the most leading causes of infertility in women of childbearing age across the world actually. About 10% of women have it. Not everybody knows that they have it. And it's essentially a hormonal imbalance. It presents with a variety of symptoms. One is excessive weight gain, real difficulty in some cases in losing weight, excess hair, acne, and in some women it can actually cause insulin resistance and go on to lead to diabetes.
How is polycystic ovary syndrome diagnosed?
Sometimes it can be diagnosed just from the symptoms alone, but generally most doctors will do a hormonal panel blood test and also an ultrasound scan.
What causes polycystic ovary syndrome?
Well, actually until recently, scientists didn't know what caused polycystic ovary syndrome, but recent studies suggest that it's an excess in a hormone called anti-Müllerian hormone, which actually measures your egg reserve. Anti-Müllerian hormone triggers the brain to release excess testosterone, which then actually creates a domino effect of hormonal imbalance, which then actually affects the reproductive process. So for women that are older, say in their 40s, sometimes having polycystic ovary syndrome can potentially be a good thing, because as you get older, your anti-Müllerian hormone levels come down. So women in their 40s with polycystic ovaries find it easier to actually conceive because their hormone levels come down to a normal range, and then they can get pregnant, but that's not always the case.
How can polycystic ovary syndrome affect your fertility?
What happens with polycystic ovary syndrome is quite often cysts are formed within the maturing egg, and that egg actually implodes in on itself rather than being released into the fallopian tube. So for a lot of women with polycystic ovaries, they don't always ovulate. Cycles can be very, very long, and sometimes polycystic ovary syndrome is measured by excess levels of follicle stimulating hormone. So basically the brain is sending out follicle stimulating hormone to the ovary saying, give me an egg, mature an egg. And actually that egg doesn't mature. So it's very, very difficult to get pregnant if one, your eggs aren't maturing, and two, you're not ovulating or having periods.
What can someone do to enhance their chances of conception if they have polycystic ovary syndrome?
Well, initially, once you have your diagnosis, sometimes your GP or your fertility consultant will put you on some medication to help control your hormonal imbalance. However, there's an awful lot that you can do naturally and holistically to help yourself. One of the things that we do at the Natural Fertility Clinic when people come in to see us, one, we look at giving them complementary therapies such as acupuncture and reflexology. We find that actually that really helps to balance those hormones. But we also give an awful lot of dietary and lifestyle advice. With polycystic ovaries, you can really do a lot with your diet to help balance out your hormones. We go into that in quite a lot of detail when people come in and see us, and we've had a really, really good response from many, many patients that have gone on actually to conceive naturally with polycystic ovaries.